Dr. Gail, please tell us why it is so important to include the gender issues in medical curriculum. And I would go further, not only for MBBS, but other medical related curriculum like for nursing curriculum, which is a very, very important thing. Nursing support is very important, rather more important than doctor support. Why it is important to have these things in curriculum? Dr. Gail, please.
Thank you, and thank you for having me today for the webinar. I'm part of the faculty at the University of British Columbia, and we have sex and gender as part of our curriculum in year 1 and year 2, and also in year 3 and 4, people are able to take electives in this area. And I find that people or the medical students are much more comfortable talking to people about their sexuality, also about their gender. And then they're much more likely to ask people those questions when they're seeing them in residency and also in practice after they graduate. So I think it's really important that earlier that we introduce this in the curriculum, the bachelor, and before we started when we were meeting before the webinar started, I was saying that WPATH has been involved for the last 3 years co-leading a seminar with the American Medical Students Association. And this has been very successful. We've had it once per week for 12, 14 weeks. And we've run this for the past 3 years and had medical students join from across North America and Central America, and it's been very successful. So that's maybe something that that we'd want to partner with T and the different members here, Lady Harding, to have a similar series.
Okay, see, for including any subject in medical curriculum, it's a long, arduous task. And we need support from everyone, from international agency, from national groups, or from activists, from everyone. So that will be required. Taking this issue further, currently we are having a competency-based curriculum for MBBS and for post-graduation courses also in India. And this formally started about 2 years ago with 2019 batch of MBBS. I don't know whether Prachi belongs to 2019 batch or not. Okay, maybe the juniors are undergoing through this. So to know for everyone that what competencies are required to practice gender affirmative care or gender friendly care as a healthcare practitioner, maybe nursing, or as a medical practitioner, doctor.
Well, we base them on competencies that are found in the medical curriculum within North America. And there's 4 competencies: caregiver relationship, content knowledge, interdisciplinary practice, and also professional responsibility. And it was a really interesting exercise for us at WPATH about how we went about looking or trying to have these competencies, and that we gathered people from all the different continents that were specialists in terms of curriculum planning within their universities and medical schools. So these 4 competencies are agreed upon across people from different continents.
That is there, and actually in curriculum we need to define what competencies a student need to learn, what they may be aware of, what they must expertise, what they should demonstrate. So few of them maybe just first of thing it comes the respect for the patient. If we respect our client, if we respect their decisions, if we respect their desires, their positions, then everything else will come through following that. And definitely we have to practice like making a rapport and then going through it, through those counseling steps. And if we find, not because of personal prejudices, but if we find something is not correct as the society believes or as the science believes, then maybe we may need to change in that person. But science is changing fast. And I would like to confess that most healthcare providers do not understand the subject of gender affirmative care. But I am also very happy to note that people are ready to learn about it. In the same way, Government of India is also showing a way, having adopted some legislation regarding this, having decided to make a center of excellence in All India Institute of Medical Sciences in New Delhi, and also having decided that similar center of excellences will be made in every medical college of India. We have about 600 medical colleges in the country. So this time will come, certainly with the activism of ATHI, WPATH, and many such organizations, and Curentia, and we can count on Lady Hardy Medical College also on that, certainly. So WPATH is a world organization. So how WPATH can help or is helping in establishment of these center of excellence? If you can tell something about WPATH and its role in such centers.
Sure. So WPATH is an organization that has been, it's a nonprofit organization that was formed in 1979. I heard the other day that we are 3 members short from 3,000. So we're almost at 3,000 members. And one of our activities or main activities now is the Global Education Institute. And we've trained over 5,000 people over the last 2 or 3 years. And over the last year or so, with the COVID pandemic, we have switched to online training. And so we will continue to do this as we see how the health situation is going, or the pandemic situation. Our trainings have been very successful. We have a foundations course. We also have advanced courses in medicine, in mental health, in child and adolescence. We also have a course in ethics. And what we're doing is adding more courses as people come forward and give us ideas in terms of what they would like to see. We also have a certification program, which is a member benefit, and people are also welcome to join that program. And there's been many people of the ATI board that have taken the GEI courses and have become certified members. And we have Dr. Sanjay there as one of our main people that has been leading everyone.
Thanks for telling about WPATH. Actually, when this issue of medical education comes, we can divide into broad categories. One is in-service education, means those are already qualified their medical degrees and are now practicing. Another becomes pre-service education, where students are taught about any subject. So the curriculum issue is for those who are still a student or who will become a student in future. But this in-service education is also very, very important, because we need to make aware or make them friendly a large number of practitioners in the country. Okay. So such courses are very handy, are very, very important. Such courses, such webinars, such CMEs, and after establishing those center of excellence, I think they will surely benefit from WPATH, because we already have some similar courses. They will also develop some similar programs. And Government of India has its own portal for such online programs, which are free, available to every citizen of the country, and maybe from outsiders also. And institutions like Indian Academy of Pediatrics also has a very strong component of training and very strong component of CMEs and conferences. So this issue will certainly come up for education and making people friendly of Indian Academy of Pediatrics. But current time is for strong data. Everyone asks for the data. Even I would also wanted to ask for data from Dr. Sanjay Sharma when he says about 15-20% people are affected by this issue. This looks a quite big number to me. Still, I can't believe it. But yes, for people like me and for any other people, we need a strong research component, and we need a strong research from India or Indian subcontinent, because we have the Indian subcontinent would have the largest population in the world from this particular area. So how important is the research, and how should we go about collecting data and having our own evidences that yes, things exist and their needs are this. It is us we need to understand and change ourselves to provide those needs.
Well, actually, just yesterday, the European Professional Association for Transgender Health just finished their conference. It was from the 12th to the 14th. And EPATH is one of the divisions of, or one of the areas of WPATH. It's a European area, and they were the first people actually to start the big data sets. You're asking about the about the data and about the research. They were really the people that started it. And the other now the US in the last about 5 years has started to make these big data sets and big collections. And so we would really like to partner with the people in India and also create these big data sets to have the numbers that you're looking for. And because now that we have people we can learn from people in Europe and also people from North America, and we have this expertise that could come together and work together as partners to create this big data set across the Indian subcontinent, because you have the largest number, as you were saying.